Identify your patient.
What is your name, sir?
James Smith,
What is your date of birth?
9/17/85.
Explain the Valsalva maneuver to the patient and have the patient demonstrate.
I'm going to ask you to hold your breath and bear down as if you're having a bowel movement. Can you please demonstrate that?
Okay.
Wash your hands and put on gloves. Clamp and disconnect any IV that is running through the central line. Place the patient lying flat without pillows or in a slight Trendelenburg position if tolerated. Have the patient turn their head away from the catheter. Remove the old dressing to avoid dislodgement of the central line. Discard the dressing and gloves. Put on clean exam gloves. Remove the sutures. If a catheter tip culture has been ordered, cleanse the site thoroughly with CHG in a back and forth motion for a minimum of 30 seconds, and then allow the site to dry. Instruct the patient to take a deep breath and hold it in.
Take a deep breath and bear down, sir.
Gently withdraw the catheter while applying firm, direct pressure at the insertion site using an occlusive dressing. If your patient is unable to follow instructions, remove the catheter at the end inspiration. If any resistance is felt, removal is aborted and the attending physician is notified immediately. If a catheter fracture occurs, apply direct pressure over the site, notify the attending physician immediately. Obtain a stat chest x-ray and notify interventional radiology for removal if the catheter fragment is identified. If the catheter fragment is palpable, apply additional pressure distal to the catheter to prevent migration and proximal to the catheter to prevent air embolism. If tolerated, position your patient in Trendelenburg and on their left side.
I'll roll you onto your left side, okay, sir?
To determine whether a tip has been fractured, note that the tip of a good catheter is blue and the tip of a fractured catheter is missing the blue tip. Okay, lay him back on his back. If a culture was ordered, once the catheter is removed from the patient, and with assistance from your assistant, cut 1 inch from the catheter tip and place into a sterile culture cup. The remaining portion may be discarded appropriately. Do not sit the patient up at any time during the removal or immediately afterwards. Do not massage the IJ site after the removal. Continue applying firm pressure for several minutes until the bleeding stops without lifting the dressing. If there is an absolute need to assess the insertion site, peak slightly by lifting the edge of the dressing without decreasing pressure at the site. When bleeding has stopped, Secure occlusive dressing and label with date, time, and initials. Dispose of equipment appropriately and wash hands. The patient should be instructed to remain supine for 30 minutes post-removal or as appropriate for the clinical situation.
Please remain still for 30 minutes, sir.
For removal of a central line from the femoral site, the patient should remain flat without hip flexion for at least 2 hours. Monitor for signs of distress during and after removal. If distress is observed, call RTT immediately.
I can feel a little in the office.
Okay.
Place the patient on their left side.
On your side.
Use the Trendelenburg position if tolerated, and put the patient on 100% oxygen. Side roll your patient if nausea or vomiting occurs. Do not sit the patient up. Observe the site for bleeding and hematoma formation. Recheck dressing within 10 minutes and as needed thereafter. The dressing remains in place for at least 24 hours. Periodically, the site needs to be assessed for circulation and movement as appropriate to the clinical situation. Document the removal in the electronic medical records.